Hello, thank you for joining us again today. Today we're going to be speaking about coping with COVID-19. We have a panel of experts today, so what I'm going to do is I'm going to ask those experts to just let you know who they are and what they're here to talk about today. So for our first person, Don and Jill, would you be able to tell folks about yourself?
Thank you. I'm the Director of Emergency Management for Teller County. I'm one of the main conductors of the orchestra for our response planning and mitigation efforts as we go forward. I've had the opportunity to do this on a number of incidents. However, this is the biggest and longest that any of us have ever seen. Thank you.
Thank you, Don. Darren Tangeman, the City of Woodland Park.
Thank you. My name is Darren Tangeman, the City Manager of Woodland Park. I also serve on the COVID-19 Economic Development, Economic Impact and Recovery Group, and I'll answer questions related to the city's coordination with the COVID-19 response and any issues in terms of what we're doing with business relief and the recovery effort. Thank you.
Thank you, Darren. Mark Dittenreiter, Teller County Commissioner.
Thank you, Sheriff. I'm Mark Dittenreiter, Teller County Commissioner. I'm a member of the Teller County Economic Impact and Recovery Team. I'm here today to talk about any business and employee relief measures. Thank you.
Thank you, Mark. Steve Wolf, Superintendent of Schools for Woodland Park School District RE2.
Hi there, my name's Steve Wolf, as he said, and I'm the Superintendent of Schools. And any questions you have dealing with the schools, be glad to answer. And he won't say it, but today is Jason's birthday. It turns 3014 today. So happy birthday to Jason. He just loves being on screen for his birthday. So any questions you got?
Thank you. So I do have a ability to say I got a year older today, so if I forget something, it's not my fault. Kim Mothy, the Director of Department of Human Services, Teller County.
Hi, I'm Kim Mothy. I'm the Director of DHS, and I'm in charge of EFS 6, which is all the human resources, mass shelter, and those kind of things. I'm here to speak about what resources our agency can provide and adult and child protection issues. Thank you. Ask away.
Thank you, Kim. Dr. DeWall, Teller County Regional Medical Director and Staff Physician with EMS Directors.
So I'm Jeremy DeWall, the Medical Director for Teller Regional EMS, which extends from Manitou Springs throughout Teller County into portions of Park and Douglas County as well. So I'm here to be able to answer any questions regarding EMS response and general hospital response as well.
Thank you, Dr. DeWall. Jackie Ravella, Director of Teller County Public Health and Environment. Jackie?
Good afternoon, and thank you all for tuning in. This worldwide pandemic is unprecedented, and the public health measures that have been employed to fight and contain it also unprecedented. The only other event that could be considered somewhat comparable was the Spanish influenza pandemic of 1918, and not many of us were around for that. So with COVID, we are applying our knowledge, our skills, and developing new protocols. We have public health plans to mitigate communicable disease and pandemics, but there are aspects of COVID that are new. And honestly, we have to apply our knowledge and skills to figure some of it out as we go. Public health is notified when there is a positive COVID case in Teller County. We begin our investigation, which results in putting prevention measures in place. The ill individual is told to isolate themselves, which means staying home, away from others, and treating symptoms at home. With each positive case, we perform contact tracing, which means we identify close contacts and determine if exposure may have occurred. If it did, we will contact those individuals and direct them to self-quarantine for 14 days. People in isolation are sick. People in quarantine may get sick. So we need both groups to separate themselves from others to prevent infecting others. This virus is spread person to person by respiratory droplet, like in a cough or a sneeze. So we need to put distance between person and person to prevent spread. This is the reason for all of the social distancing orders, putting distance between person and person. Knowing how many cases there are is impossible without the ability to test more. We do not have enough testing supplies, therefore cannot perform the testing that would tell us more. Currently, Teller County does not have a testing site for the general public with symptoms. There are sites in Colorado Springs. We're working on that. Public Health will be implementing a symptom tracker where people can report their symptoms online and receive guidance on what to do. Look for that information on the Teller County COVID website as soon as it becomes available. This will help us all know more accurately the presence of COVID in Teller County. Who would have thought that a single-cell organism, a virus, could have such impact on our health, our families, our freedoms? A germ that can cause infection, disease, and even death. A germ for which we have no medicines to treat or vaccines to prevent yet. Some people don't believe in vaccines. Some people think vaccines cause harm. Well, look around you. This is the world without one vaccine, and look at the harm. People are dying. It's a new virus. No one has immunity. There is no community immunity. Hopefully there will be one day, and we will be protected from infection. Together we are a community, and our best chance of protecting the lives in our community is to work together. Ask family, friends, neighbors, and fellow community members to help save lives by following the public health orders. Ask nicely, be kind, be respectful, and understand that some measures are required and some recommended. Practice personal responsibility, stay at home, limit your contact with others, cover your cough, wash your hands, and don't touch your face. These are the public health measures that can make the difference. You can make the difference. Thank you.
Thank you, Jackie. So my name is Jason Mikes. I'm the Teller County Sheriff. I'll be your moderator for today. And I'd like to remind you to please text to the 720-583-5001 with any questions you'd like to have answered today. Thank you. So our first question is, what should we do if someone will not obey the social distancing orders? Who do we call? I think I get the toughest question to begin with. So, yes, is there an order to not have people within 6 feet of one another? The issue is I have to weigh on a daily occurrence what the right thing is and the wrong thing, and where do I take away people's civil liberties on the basis that they must stay 6 feet away from someone? And my officers don't carry tape measures. So the issue we run into is we've made this more of an information at this time. Most people that we run into know to keep the distance. We try to make ourselves seen in the community so that people know that they need to follow those guidelines. But right now, are we writing tickets for people not standing outside of 6 feet from someone? No, we're not. And I don't believe we should at this point. And I know that becomes some of a shock to some folks. But the issue is enforcing that order at some points is best served by enforcing information first. And then if it continues and it gets worse, then we start issuing those citations. But right now in this county, we do not do that. Second question. And I'm sorry, my phone scrolls fast as they get new questions, so I have to keep finding them. How many of Teller County cases have recovered? Jackie, that question's for you.
So let me explain recovery data first. So the CDPHE website, which has a lot of Colorado data on it, is accurate, and they do have recovery statistics on there. However, they do refer to people who have been hospitalized because of COVID and have been discharged. People who have recovered are basically those people who have not passed away. So the recovery rate is pretty high. We still think at about 80% that most people recover. So when you look at recovery rates, understand that it's those who are discharged from hospitalization.
Thank you, Jackie. The next question goes to Dr. DeWall. I'm afraid to go to the emergency department or use the ambulance because I'm worried I will be catching coronavirus. What should I do if I'm not feeling good?
It's an excellent question. So when we look at our data currently with emergency medical services, in Manitou Springs, our EMS call volume is down approximately 24%. In northern Teller County, we're down approximately 30 to 40%. And in southern Teller County, we're down somewhere between 80 to 90% for emergency services call volume, which means the community in some ways is doing the right thing. They're staying home if they're feeling sick and they don't require emergency services. That being said, we do have a concern that patients who should be calling 911 or who should be using an emergency department are not. Those are the patients who are having chest pain. Those are the patients who are having stroke-like symptoms. So we have heard from areas like New York that are heavily hit that they are actually seeing increased death rates in people who do not have COVID, and that's because they're afraid to go to the emergency department or call the ambulance. So I would strongly urge you, if you do feel you have a life-threatening condition, such as stroke, heart attack, if your arm's falling off, if you've cut yourself, if you have some infection like a skin infection that needs treatment and you can't get into your physician, those are the opportunities to use. If they're minor to moderate, use telehealth services, use those type of services. But absolutely, if you feel that you have a potential life-threatening condition, you should call 911. We'll come out, we'll assess you. If it ends up that you can stay home and things look okay, we'll tell you that and help you with follow-up. If it is something that we feel you should go to the hospital, we will get you to the right place. In regards to the hospitals are more than capable, and this includes all our hospitals, both Pikes Peak Regional Hospital and Woodland Park here, as well as our hospital systems, all three of them in Colorado Springs, are able to care for our patients and keep them safe. Yes, hospitals do have COVID patients in them. Yes, those patients are in isolation as well as are having personal protective equipment used by both our EMS crews as well as by our hospital staff. So we can keep you safe, but we certainly don't want more death, more disability, and more issues because people who have chronic medical conditions can't get into their primary care physicians, or people who do have life-threatening conditions are afraid to call 911 or go to the hospital.
Thank you, Jeremy. So the next question is, how is Teller County handling the increase in local COVID-19 cases and resulting deaths in our area? Jackie, I think that you got that one.
That goes back to what public health practice is all about when it comes to communicable disease prevention and mitigation. So COVID has become a reportable condition, and there are many others, things like pertussis and E. coli and those kinds of things. So we practice our regular protocol on, we get the report, we do the investigation, we implement mitigation and prevention measures, and then we monitor it to make sure that there's been no spread from that case.
Thank you, Jackie. Next question. My wife and I are getting stir crazy here at the house with our kids. We sometimes suffer with anxiety, depression because of feelings, locked up all the time. Where can we get help? Anybody like to take that question?
I can take that question. As far as any kind of mental health, behavioral health, simply coping strategies in dealing with a stressful situation, and this situation has certainly caused situational stress in a lot of us. On the Teller County website, we do have some mental health resources. We are implementing, starting next week, we're going to be doing weekly podcasts on kind of coping strategies, things like challenges for maybe older adults or children. And then first podcast's topic is going to be cabin fever. And I think that not only fits with sort of the end of the winter season, which we often feel cabin fever, but even in this stay-at-home order, and the homeschooling unusual stressor that has occurred. So we are working on putting more and more resources. There is a crisis hotline. If anybody is in any kind of mental health crisis, you should call right away, and that number is on the website as well.
Thank you, Jackie. So again, that website is Teller COVID, or Teller COVID, so you can find that information there as well. Next question. How many tests have been done in Teller County? Jackie, again for you.
We don't know the answer to that. Jeremy, do you have an idea?
Our testing numbers, remember when we test patients, the primary patients who are being tested right now include patients who go to an emergency department because they are sick enough to require hospitalization. And when those patients are being hospitalized, those are the primary patients that are being tested, are patients who are hospitalized, who have high risk factors such as extremes of age, comorbidities like renal disease, heart disease, lung disease, diabetes, other immunocompromised states like cancer. In addition, the other population that we are testing is our first responders. So that is critically important to keep our EMS resilience, emergency services resilience, so that we can continue responding to the needs of our community. We do know that as testing supplies become more available, we will be testing more people, and that number will go up, but I honestly can't give an accurate number. We know more so the number of positives rather than the number of overall tests.
And to add to that, some of Teller County residents are getting tested in El Paso County, where there are more testing resources. But I will add that on the basis of if you think you have COVID, and a lot of it is a clinical sort of assessment in regards to the symptoms, if you are symptomatic, then you can kind of assume that this could be COVID. And we ask you to to self-quarantine yourself and stay away from others, because we do recognize we do have COVID cases that have not been formally diagnosed.
And Jackie, you bring up excellent points, because really when we look at testing for COVID as well, the tests aren't perfect. Some of the tests are very good. Some of them are not very good. We have some tests that have up to 30% false positive, which means they come back positive in someone who does not have COVID. And also we have up to 30% false negative, which means someone does have COVID and it's giving a negative result. We're actually seeing that as people have COVID longer, it moves more from their nose and mouth area down into their lower respiratory tract. And then those patients are actually testing negative for the disease. So even if you do go to the hospital and end up needing admission because you meet admission criteria, there's a lot of patients that are still testing negative, but we presume they are positive. We treat them as though they have COVID with all of the appropriate precautions as well as appropriate treatment in the hospital.
So I guess in a nutshell, the issue is we just don't have as many testing kits as people think we do. The other side of it is you have the ability to test it's just not here yet for the general public. And the reason why we're doing a lot of the testing for first responders is those first responders are having multiple contacts with people in our community. So that's why they're trying to do that first, so they don't infect the standard population through what we do. Correct?
That's
Okay,
correct. And it also, remember, even if we test our first responders, and I know people worry because of the false negative rate and those things, is a first responder going to come to my house now who does have COVID and tested negative? Remember, all of our first responders are wearing personal protective equipment for two reasons. One is to protect themselves in case someone has COVID. The other is to protect the patient in case the first responder would have early onset that they're asymptomatic. So it really goes both ways to protect the patient, the community, as well as the responder.
Thank you, Jeremy. The next question, who is allowed to be tested and where is the testing done? I think we've covered that one enough.
Yeah, I think we're covered there.
All right, I missed that one. So the next one, when will the antibody testing be available in Teller County?
We don't know.
That's correct. And there's actually issues with the antibody testing. So keep in mind that antibody testing tells you exposure or previous illness to disease. It does not tell active disease. And what currently matters for us managing this disease process is active disease in the community. That's what we care about. Ultimately, when we talk about reopening slowly, those kind of things, yeah, it is helpful to understand, has someone been exposed that they could potentially have immunity, but we still don't know that if exposure for everybody means 100% immunity. So Jackie, maybe you can speak to that
And the
more.
gold standard for testing is still the nasal or oral swab. The serological testing still has some bugs in it that they're trying to work out, as well as the labs that are able to run the tests. There's still some work being done there.
Thank you. So we're going to switch gears from the public health side of things and the medical side, and we're got a new question. What plans are there to get us back to work? Anyone on the panel like to tackle that question?
Sure, if I can take that. So right now, when we look at the recovery piece of this crisis, it's really important for us to be proactive and start thinking about what happens after the end of this month when the stay-at-home order may be lifted. Most of you probably heard the President of the United States last night indicated that he's going to be leaving a lot of this up to the states, to the governors. So here we are as a county, and we have to prepare just in case it comes down to us. The governor could end up making decisions that will be statewide mandates as far as the phasing, reopening of our society, if you will. But if for some reason the governor decides, counties, it's up to you, you make the call, then we need to have a plan in place. So we are in process now looking at different possibilities. We're of course going to look at the science and the data. The planning section of our incident command system is taking a look at some of that. We also have our Teller County Economic Development, Economic Impact and Recovery team. We're very engaged in this, thinking about the different scenarios. A lot of this, we got to be smart about it, but we also need to open up for business. That's key. It's been long enough, but there are concerns, of course, from the public health front. We need to preserve and protect the public health. At the same time, we need to ease into to getting back to normal as far as our life is concerned. We are collaborating with the cities, getting their input on this, and we have to think about, all right, what does this look like? Personal protective equipment, masks, the number of people in given spaces at a given time, also our social distancing practices. So all of these factors are on the table, but we need to be smart again, and we're looking at it. Thanks, Sheriff.
Thank you, Mark. Darren, do you have anything else to input on that?
I'll just say the city is a partner in that process. I know that the Office of Emergency Management has requested input from our city on the 21st, and I know we're meeting on Monday at 3 o'clock with council members and members of our business community to start putting some of those condition-based triggers, getting that planning done so that we can pass that information on to the county for a more comprehensive approach.
And let me just add a little bit of the public health perspective. And I think as we're looking forward to sort of planning that sort of relaxation of the social distancing orders, we do need to remember, though, that it does boil down to the public health and safety of the community. And from my perspective, we don't want to risk that. So anticipate that the reopening is going to be sort of gradual. And we need to remember that the number of cases throughout the state, as well as throughout Teller County, are not going down yet. They're still going up. And so we anticipate a slow reopening so that we can continue to monitor how that might impact the number of cases. And we ask that the community be flexible in that if we slowly start to reopen and our case numbers go way up, we may need to pull back a little bit. So we ask that you guys understand that our ultimate goal is to protect the health and safety of lives.
Thank you, Jackie. Next question. Will there be a fire ban even with all the snow we've had lately? Don, you want to take that one?
Teller County will take a look at the fire ban restrictions. The sheriff and I meet continuously as we take a look and the conditions hit certain triggers. We will implement a fire ban in accordance with our other adjoining counties, our federal and state agencies, and so forth. But it's hard to implement a fire ban today per se when we still have snow completely on the ground. However, welcome to Colorado. That could change in less than a week. So we monitor that daily. That is part of our safety message as part of the incident management team. We coordinate, communicate, and look at what the triggers are and where they stand. So thank you, Sheriff.
Thank you, Don. And the big side of that, too, is we're trying to not use all of our resources. What we don't want to have is an incident within an incident. We've done that here in Teller County before, and I will tell you that it is a drain on the resources. We've run the Waldo Canyon fire with a Springer fire with an arson issue that we had many years ago, all at the same time. And what it takes to run any of these operations is an immense amount of manpower, time, and money. So what we're trying to do is keep our incidents down to a single incident that we can manage, and not draw down on all the resources and personnel within the county. Next question. Is there any plans to get a county-wide testing site? Jackie?
We're working on it, so the answer is yes. Thanks to the work that Dawn and Office of Emergency Management has been doing, and our partners at UC Health and our EMS agencies, we had opened a community testing site, how many weeks back? 3 weeks? And my timeline gets a little crazy. About 3 weeks back, and it was a great collaboration between the agencies in order to implement that, and unfortunately, the limited testing supplies caused us to close it earlier than we had anticipated. So yes, we are working on it. We are being told from the state health department that supplies are starting to roll into the state, and so it'll definitely be part of the reopening plan for the county.
Thank you, Jackie. This one's for Steve. Oh, it just ran out of my view here. So Steve, what is going to happen to the seniors that were supposed to graduate?
They're still going to graduate. We're right now, we had several different ideas, and we're still developing those. And the people we wanted involved in making that decision are our seniors. And so the senior class officers have been meeting virtually with Kevin Burr, our principal, and they've been coming up with different options. And they want to do it on the day. Now, my idea, I'd like to move it back and have a big celebration later where we all can physically do it. But the seniors are telling us, no, we want to do it on that date. And we've got to find a way to do that where we follow the rules that you've heard today. And they have some pretty good ideas. So that's going to happen. I hope, we're postponing or changing things, but we're not eliminating things if we can avoid it. I'm going to ask the parents to help us out, set up a prom later. Those things are things we would still like to see happen for our kids. And an 8th grade type of graduation, how do we do that? Well, we're going to find a way to be able to do that. And so those are some things that we're working on, and it won't look the same. But you know what? Our world is not going to look the same after this. So many things are going to change, and so we feel bad for our seniors in one sense, but the other sense, they're going to find a way to make this happen, and it's a great learning opportunity as well.
Thank you, Steve. Next question. Is it permissible to ride a motorcycle on a nice day to get out of the house and get some fresh air, maybe an hour or so? Absolutely. There's no law, nothing that says that you can't do that. So please, if it's a nice day, get out of the house. Enjoy your day. Next question. Kim, how do I find out if I can qualify for food stamps?
Well, the best way to go, we have lots of different avenues, but probably the quickest way, if you have access to a computer, just to go to coloradopeak.gov, and you can apply online. We also have applications located each office, one in the Tamarack in Woodland Park, that are located outside, and you can drop a box off. And then down in Aspen Mine Center, they also have paper applications also.
Thank you, Kim. For Jackie, so it says Teller County has 17 cases. Are they all active cases, or have any of those 17 recovered? Can this number ever go down, or is it only going to go up?
So once a case is confirmed as a case, it stays a case. So of the 17 that are reported on the website, yes, some of them have recovered. So what happens is after we do our investigation and we implement the isolation and often quarantine for close contacts, we monitor for the 14 days. We do check back in to make sure they're still okay. If they had gotten notified, if their condition had deteriorated, we do get notified of that through the Colorado database. So the number will never go down. It'll go up a little bit more. I'm sorry to say we anticipate that.
Thank you, Jackie. For Kim, I've been laid off and cannot afford food anymore. Are there resources for me?
Yes, there's many resources. Of course, apply online. Realize, too, one important key thing is the stimulus dollars, whatever you're getting through unemployment or through your tax return stuff, does not count against you. So we're one agency. We also have a great collaborative action with all the nonprofits. We have Aspen Mine Center. We have the Community Partnership. We have Storehouse Ministries, Taylor Senior Coalition, and the Woodland Park Senior Organization, and Little Chapel Food Pantry. And these are all on the website that you can access. And so if SNAP, which is food stamps, is not meant to be the only provider of food, so you can access these other resources.
Thank you, Kim. Next question, I think, Jeremy, this one's for you. I know that the hospital has an overflow facility. Is it being used, and how is our hospital holding up?
So our hospital is holding up quite well. Actually, all of the hospitals in the region are functioning at well below capacity. We have room in our emergency departments to care for the appropriate patients who should be coming there, as we've talked about. And on top of that, we do have inpatient ICU beds, ventilators, everything available. In regards to our auxiliary medical site, of which is set up in Woodland Park, we have not needed to activate it yet. It is completely ready to go. Thank you to Office of Emergency Management and Logistics. It is an exceptional facility that is available in case we do need to surge. Right now, because of the social distancing that everybody is following, we're doing a great job flattening the curve. And as Jackie mentioned, we're flattening it. It doesn't mean we've stepped on it and then we've squashed it. So it still exists, it's still there. So as long as we continue with what we're doing, and we do have a very gradual, appropriate approach to reopening, we are hoping that curve stays flat and that our medical facilities can continue to keep up with the pace of sick patients. We're not going to get rid of the sick patients. We're not going to get rid of COVID anytime soon. So really, that's the whole purpose. So keep that in mind. The numbers, even when you look at places that are having very high numbers, they're leveling off, but they're still high numbers, which means each day there still is more and more patients utilizing those resources. But at this time right now in our community and our region, we are doing exceptionally well.
Thank you, Dr. DeWall. Next question for Steve. What can I do to help my kids in this time, and how do I make sure they don't fall behind with their schoolwork?
You know, our teachers have worked really hard. That week that we had off before spring break, they actually took both those weeks to really focus on on teaching different and trying to make sure that we have learning continue. And so one of the things we understand is we realize that some of you guys may have 2 kids in elementary, a kid in middle school, a kid in high school, and everyone needs devices, and they're on the internet at the same time, and everything slows down. All of those things happen. And so one of the things is to be patient and with your kids and try to put them in a situation where they can succeed and don't feel any more stress. You know, we had a question earlier dealing with the stress at home, and we understand that this can cause stress. Make sure that we're working through that. So if you're having trouble at home keeping up, maybe because of the number of students you have, maybe some of the materials, go ahead and contact the school. One of the things that we want to really focus on is being empathetic to what you need. And we understand that it's tough. Some of you guys having all the kids at home for this amount of time are going stir crazy, and just hang in there. One of the things I don't know that maybe we realize, but 10 years from now, your kids may be in college, and they may be given an assignment on what it was like back when the COVID-19 happened and we all had to stay home. What you're going to remember is that we were out of toilet paper. We had to sit there and do schoolwork and make sure you're doing the schoolwork the whole time. We were out of cleaning supplies. We were stuck there. We were tired of looking at each other. That's what you as adults may remember. What your kids are going to remember is that you were home, and that you ate supper together, and that you had time together, and you were playing games, and that's what they're going to remember about this. So try to make the memories, realize you're building memories at the same time, and we realize that as we're providing those educational opportunities, that you're going to have the same thing. And so we will work hard to be empathetic. The materials we are supplying, the education that we're working on, the learning opportunities are there, they haven't really diminished. What is expected of your kids hasn't really gone down much. We still expect a lot. This isn't a vacation online, and we realize this is our new reality, and so we're expecting a lot of the students still, but at the same time, trying not to provide too much stress. So let us know if it's too much for you, and we'll do what we can to help out.
Thank you, Steve. There's a second part to what Steve's talking about that I think is new. Don, do you want to talk about the division we stood up for public education in school districts?
Thank you. One of the things that we did do as a management team trying to balance all the needs of our community is we reached out to Steve Wolf in the schools and we said, how can we do a better job at educating not only our kids, but our parents, our grandparents, what is going on and how best we can work with our student population, our parents, and all to make sure that we all get through this together. This is not an individual thing. This is definitely a team effort all the way from education to response, to recovery. It is all of us combined together. So we did. We stood up a public education branch, and Steve and Tori are taking it upon themselves to help us build that out and get additional information sources on Teller COVID, as well as personally reaching out to those people who reach back and want help. Thank you.
Thank you. To add on to that, our parents have done a phenomenal job of getting on and making sure their kids were on. That first week, I was worried at high school that we might, if we're lucky, have 70% engage and do the work they needed to do. 100% of our high school kids were on and working and rolling. And we're also concerned about food security. We realize that our students, a lot of them, that breakfast and lunch is huge. It's huge for you guys. And a lot of you may be out of work and food becomes an issue. We want to help with that. So we're serving over 400 kids per day at 3 different sites, one out at the Grange at Florissant, here at Summit Elementary and Divide, and at Gateway Elementary. And so they stack you up with food, especially on Friday. If you were there today, they loaded you up. And so it's great food, and it doesn't cost a dime. Anywhere from age 2 to 18, if you're homeschooling and have nothing to do with me, please have something to do with the food, and go get it. We want to make sure that your kids are taken care of and to help you in your home.
Thank you, Steve. I think it's important to understand that when we go into a briefing or we start thinking about those things that are affected within the county, all of these partners come together from Woodland Park, Cripple Creek, the city of Victor, Karis, Bible College, to the schools, to so many others, identify things that we can do better. And that's why under this command structure, you're seeing like public schools. That's never been done before under an ESF structure, but it's something that we thought was needed for this county and just for all that we do. Next question is for Darren. How are the businesses in the cities doing? Are they getting any assistance from the CARES programs?
I can speak to some of that. I know that in terms of the CARES program, just talking anecdotally to some of our local banks that were issuing those the Paycheck Protection programs and the CARES programs, there were, I believe, one of the anecdotal numbers was 86 businesses had applied as of last Friday, I believe, to just one of our banks. And so I know there's quite a few. As you know, yesterday, I think the Congress is trying to refund some of those initiatives. So we'll have to kind of start again at some point in the future. If you could, the other portion of the question.
Sure. It was, I'll just repeat it.
Sure.
How are the businesses in the cities doing? Are they getting any assistance from the CARES program?
We're seeing, so we did a recent survey, had around 50 or so responses on a survey to our community. I will tell you, there's a number that are closed, there's some that have reduced capacity, and there's a number that are still open. Some of our larger businesses are actually doing pretty well. It's a little bit different than what we would have expected, but those businesses are reacting to some of the supply demands that a lot of us have been talking about in terms of food and supplies. And so I'm not sure how long that will last, but that's a positive aspect of that. But we do have a lot of our small businesses that are either reduced in capacity or are closed right now. And so they've all been encouraged to apply for those CARES programs, and what we're seeing is evidence of that.
If I may add to that, Sheriff, the Paycheck Protection Program, PPP, and the Economic Injury Disaster Loans, the EIDL loans, as Darren indicated, those are frozen as of right now. The next round of legislation coming from the feds hopefully will inject another $250 billion into the Paycheck Protection Program specifically. So far, $5.8 billion has come to Colorado small businesses. That's 28,000 approved loans, and that's 1.6 million loans nationally, 339 billion across America. The PPP, as many of you may know, you need to go to your local lender to get started with that process. I think despite the fact that these programs are frozen and all the monies have been appropriated at this juncture, I still would encourage you to get out there online and apply. So when the next round of funding does come available through the COVID 4 bill, then you're ready and you'll be in the queue.
If I can, I want to just emphasize that once that program gets unfrozen again, it's a fantastic program for our small businesses. If you need information about it, I believe you have it on the COVID-19 website. The city does as well. City of Woodland Park's COVID-19 website has the information about the Paycheck Protection Program and the IDL program. So if you want to go there to get more information, please do. Also reach out to your local lenders, as Commissioner Dettenreiter stated.
And additionally, as far as resources go, please connect with the Pikes Peak Workforce Center. Lots of resources there to help businesses, as well as the Pikes Peak Small Business Development Center, the SBDC.
Thank you. Darren, you got some?
I'll touch on a couple other things. In terms of the city of Woodland Park, some of the things that we do, the city actually was awarded an SBDC grant last year, and we're working with some of the resiliency training for our local businesses. But one of the things we want to focus on as well, if there's any businesses out there that want to receive some free e-commerce consulting to expand their business model to make them more resilient in times like this, please reach out to the city and the chamber, and we can arrange for that consulting for your business for free within the city of Woodland Park. So it's something we want to do. That will not only help us now, but into the future. We're also doing a lot of different things in terms of we're doing deferments. A lot of the cities are doing deferments on utility bills and/or waiving fees. The city is deferring our utility bills for the next 2 months on a case-by-case basis. So if the community has a need, if they're impacted by COVID-19, they can reach out to the city billing department and get those deferments. We also are not shutting off water and utilities at this time until the declaration is rescinded. We're also waiving penalties for any sales tax remittance to the city, sales and use tax to the city as well. So we're trying to do things to assist local businesses to persevere during these difficult times.
And if I may add on one more thing, as far as accessing resources, on the Teller COVID site, there's a great place. Look for Employer Resources tab, as well as the Woodland Park Chamber site. Those are good places to get direct links to resources that can help you if you are a business that's struggling at this time.
Thank you, Darren and Mark. And Renee, can we make sure we get all those links put on the Teller COVID site? So go to the Teller COVID website. We will have links on there posted for everybody's websites and where to find that information. I do have to say, my wife has a small business in Woodland Park, and I'm proud to say that the city of Woodland Park is doing a great job with helping with those things. I also have to tell you, I was up at midnight answering emails and working on COVID issues, and I got an email from Tony Perry at midnight over helping small businesses. I just got to give a shout out to those guys for the amazing work they're doing at all hours of the day to help businesses. What a great community to have as a response. Kim, next question. Where can families who aren't able to find work get help with paying their bills and feeding their families?
Well, again, the website I noted is the best thing. Let me just kind of review some of the programs we have in our agency and what other nonprofits are doing. For DHS, we have child care assistance. We have temporary aid to needy families, which is TANF, which is probably one of the best resources we have. We have SNAP, which is food assistance. We have old age pension, and all those programs, those are the main ones. We have some variations of those, but like TANF, depending on your circumstance and your total income of your family. For example, if you make $75,000 or less, you can qualify for being on TANF, which is, we have different programs and diversions. For SNAP, that's all the requirements for that program are really pushed aside. You can go online. Again, the best way, if you can manage to go online, you can use the applications that we have outside our offices. But that way, we don't require interview. We just have to have proof of your citizenship, and we can process that. Regarding childcare, there's a couple different things for childcare. We're trying to keep our childcare programs going, and so for first responders, we do have free childcare for 2 weeks, and we have a listing, I believe, on the website that gives a link to that. Also, we do have childcare assistance, our normal stuff already going on. So again, the best way to do, if you meet those requirements, to go online. We also have nonprofits that are very active in the community that if you don't qualify for our assistance, we have the Aspen Mine Center, the Community Partnership, Storehouse Ministries. Those are the most family-centered ones, and they can do lots of things, food delivery, items. They may have resources that we don't have. So we really are working together as a community throughout the whole county. So I hope that answers those questions. But again, the website has a lot of good information, and I can't encourage you enough to apply.
Thank you, Kim. Next question is for Darren. Darren, what is the status of farmers market?
As of right now, I know that they're planning with the Teller County Public Health Department to try to do a farmers market, a restricted farmers market based on the restrictions that the state has laid down. I know that our the farmers market within the city is working closely with a board at the state level that are establishing and creating these restrictions. Clearly, it would be focused on ag and the produce side, and there would be restrictions as they are applied in the public health order. I'll let Jackie. I think Jackie
Yeah, I can add to that. Thanks, Darren. So farmers markets have been deemed to be an essential food source in the state of Colorado, and at the state level, they have created guidance that they are sort of vetting through the farmer market coordinators. So we are definitely going to, I think we'll be able to have our farmers market with, it'll look differently though. And so there'll definitely be a limit on the booths, the number of booths, the distance between the booths. It's going to be food only, not the crafts. And they'll try to direct flow of traffic. We're going to try to maintain the social distancing and no mass gatherings. So we're going to try to control the flow of the public as they come in to buy from the vendors. You may see additional strategies like, you can't touch the food and the vendors will have to select it for you. You could probably point to it and they'll pick out what you want. But we're hoping that the farmers market will be able to occur. It'll just look a little bit differently. So the community's cooperation with that would be much appreciated.
And I think the scheduled first date may be the third week of May, but it may be, depending on how this works out, it may be into June.
Thank you, Darren and Jackie. Next question. What's up with the trailhead signs about limited rescue? I have no clue. Is that great? Because I have not heard that before.
Yes. So I believe it was last weekend, Teller County Search and Rescue, along with Pikes Peak Medical Task Force, which is the backcountry medical task force that exists within the Teller County area, made up of fire department and EMS departments, put out some signs on trailheads that essentially say, think before you go, you are your own rescuer. And we have seen these throughout the state. There's actually numerous search and rescue organizations that are doing this. And it's really to make the public aware that when they're going backcountry or even going up some of our trails within the area, that there is going to be a delay and some limitations with rescue. When it comes to backcountry rescue, we have to assume at this point, because of community spread, that anybody could potentially have COVID. That's why we have social distancing. So with it, it usually takes a pretty significant number of rescuers in order to extract someone from a backcountry setting, or even some of our easier trails throughout the area. And with that, all of those providers are using personal protective equipment. That's a significant strain on our PPE stores. It also means that we are going to have to limit the number of rescuers who are going in to help someone. Where we may typically use 12 to 20 rescuers, we may be using 4 to 6 or 8 rescuers, purely to decrease exposure and PPE use. So we want people to be prepared that when they go backcountry, if you break your leg or have another injury, think about how are you going to assist getting yourself out. And that's the purpose. Right now, we do have the resources available, as we've talked about, from the EMS and the search and rescue side. But if, God forbid, things do worsen, and we end up with more COVID responses and more strain on our healthcare and EMS and rescue systems, we may not have the capabilities to be out for 12 or 14 hours dragging someone out of the backcountry. So it's more to warn people. I can tell you that I took a ride up this weekend up to Rampart Reservoir area, of which most of it is closed down by the National Forest orders. And there was an exorbitant number of folks together up there. There was probably 40, 50 cars on one trailhead. So please think about it before you're going out. Go out, get some activity, get some fresh air, but do it socially responsibly and keep your 6 feet distance, and be prepared for yourself if you do have to get out of that situation.
Thank you, Jeremy. Don, this question is for you. What is the status of our local PPE inventory for use by medical personnel and first responders?
One of the things that we started doing back in February was we started acquiring PPE about mid-February and building our supplies. That puts us in a relatively good position for our EMS, healthcare, fire, law enforcement responders. I'm not saying that we have enough. We don't. But we do ration it out. We do monitor its use. We do work with training. We've set up videos to train all first responders in the proper donning and doffing. And we've also reached out with Battelle International for the decontamination of PPE should the need arise. So we are trying to project 1 to 2 months in advance of our needs and keep those supplies on hand. We still acquire supplies every chance we get. We know that there's going to be a national shortage over time. It's no doubt. So we just have to prolong our supplies until we can get a supply chain in the nation that can back the needed supplies to everybody. Thank you.
And a little bit more with that too. So early on, I know at the sheriff's office, we gave up all of our PPE to the cache, which is the county cache. That PPE then is distributed through what's called a 214, Don?
213.
Or 213. So a 213 for every mask and glove is requested through the cache, and then it's given out through our logistics group, which is our public works, that do a great job of logging, doing daily inventories to make sure. And what we asked all agencies throughout the county is to not hoard any of that equipment and work together so that we are able to make sure that all first responders and all medical groups and all those people that needed PPE we could get it to them. But that everyone had the same amount because it came through the county cash system for this event.
Yes. We also received donations from Cripple Creek Victor Mine, Habitat for Humanity, and many others who have donated. Too many to list right here at this time. However, you will see it on our Teller COVID site, thanking everybody who is contributing and all of those agencies and volunteers that continue to supply us with the needed supplies. So thank you, Sheriff.
Thank you, Don. Next question. Where can I find support as a parent? Would love to join a peer support group. Kim, would you like to take that one?
Well, I think one of our main resources that's a great resource is Community Partnership. They're starting to do Zoom, play groups, parenting groups. So I would say that's probably your best bet. I also know, I believe Jackie mentioned the crisis line, but through that avenue too, there are support groups that are all becoming online.
Thank you. Next question. So if other states open up around us and we're still on a stay-at-home order, are we going to stop out-of-state visitors from coming into Colorado? I'll take that one. It depends. A lot of this depends on what the governors try to do. I think this is being adopted at a federal level, and it's being allowed allowed that the governors make the decisions as to how they want each state to react to it. Then it comes down to the states to allow who's doing what. I would venture a belief that the state is not going to stop people from coming to this state. My hopes is they would not do that. I think that if you have travel outside of a state as a vacation, you may want to rethink that if you're coming from out of state to any local communities. And I know there's been a lot of information out there about counties that are stopping people from going to them or telling people they have to leave if they don't live in those communities. This will not be one of those counties. I believe that people have freedom for what they do. And the fact is, if you own a second home, you're allowed to go to those second homes. There's nothing to stop somebody from doing that. I know that there's already a lot of lawsuit issues popping up over those same issues. If you own your property, you have the ability to go to your properties. We in this county will not stop you from doing so, and I don't think it's legal to stop you from doing so. So at this point, that's all I can tell you. There's not a lot of information out there yet, but as more comes in, we'll let you know. Don, this question is for you. Are we getting any supplies from the state?
We've placed orders with the state. We have received our federal SNS, Strategic National Stockpile Reserve supplies, somewhat limited because the entire Strategic National Stockpile has been depleted. We do place orders regularly with the state, and as supplies become available, we do get our portion of supplies. However, it is limited. And that is why we continue to ration. That's why we take a look at every set of PPE we use. That's why we come up with new methods to try and minimize exposure while still wearing PPE. We're trying to take a very proactive approach. So we'll see what comes through both the state and the federal systems as supply chains get rebuilt.
And one component to this too is that our fire and EMS and law enforcement agencies, all of them are involved as well in working on getting personal protective equipment, critical medications. We have changed some of the ways that we treat our patients because of concerns over aerosol generation and things like that. But we have actually been able to obtain a relatively robust supply of critical medications, which we have throughout our EMS, fire agencies, as well as our county cash. Our PPE stuff, we have folks like Cripple Creek Victor Gold Mine who have been hugely helpful in looking at other routes because they obviously have different supply chains than EMS and fire typically do from the mining side of it, and they've been a huge asset with helping us try to obtain this stuff too. So I think between all of the different agencies and folks collaborating together, it's really been helpful to increase our numbers.
Thank you, Jeremy. Next question. Are there any resources available for parents of young kids, not yet school age, for activities and social connections? Kim, you want to take that one?
Sure. My agency probably doesn't have the things, but we refer, and I would say your nonprofits, and I know I keep on saying this, but the Community Partners Family Resource Center has lots of different activities and things that they're working on. They're serving as a clearinghouse connecting families' needs and resources for parents in early childhood. So I would say that. I would also say I know on the school districts, they send out newsletters, and those have some resources. So I know it's kind of tough, but I think those are your two main ones.
If I can, the city of Woodland Park has also just had a very successful virtual event that we sponsored, a home scavenger hunt that we had a number of over 50 families in the city of Woodland Park that participated in that, and we'll continue to have those as well to augment these types of activities.
Darren, thank you, and that's wonderful. And Renee, can you get with Darren after this? Maybe we can see how we can help with that in the county too. I think it's an amazing program. Is Teller County in a phase 1? Dawn, I think they're talking about burn bans. Can you talk about that?
If you're asking about burn bans, we are not currently in anything but burn restrictions. If you've got your permit, we are asking you to hold off because a large number of our fire agencies are volunteer firefighters who are also on the front line with COVID, and therefore our efforts are being directed to minimize any chance of fire response, pulling resources away from the needed resources that we are currently sharing with EMS, public health, hospital, and even law enforcement. We are all strapped. So implementing some of the phase 1 restrictions, yes. Are we in a burn ban? Not yet, but it will come. We know here in Colorado that it's going to dry out quickly once it starts. Thank you, Sheriff.
And to speak to, I mentioned earlier that our EMS call volumes are down pretty significant in some areas, which is good because of this exact situation Don's talking about. A lot of our volunteer firefighters, actually the vast majority of our firefighters in Teller County and the surrounding counties are also emergency medical services providers. And on average, they range somewhere around 70 to 80% of calls are emergency medical services calls within those fire departments. Our expectations and what we've been putting our volunteers through is a tremendous amount of work. So even though they're not running as many calls right now, daily they are doing education and training to stay most up to date with our treatments, with our guidance on donning and doffing, with our different response plans in order to be available to the community. So it's not that they're sitting around twiddling their thumbs. They're actually working harder than they've ever worked from a volunteer perspective when it comes to this. It's much like when they're out fighting a wildland fire, the strain, and that's what they're going through day in and day out, and they have been since the beginning of March.
Thank you both for that answer. Jackie, this question's for you. I think there's 2 parts to this, so I'll give you the second part as well. If a medication or vaccine becomes available, are you going to do a county pod? I think if you could kind of tell people what a pod is, that would help also.
That's an educated question there if they use the acronym POD. POD stands for a point of distribution or dispensing. We are anticipating a vaccine will be ready, and they're saying about 12 months from now. So when the vaccine is available and proven safe for use, and the state provides it for public health agencies, yes, we will be doing a mass vaccination clinic in Teller County. So the timeline is we can't really commit to that yet, but as soon as the vaccine is available and when the state provides it to public health agencies, that is the plan. And we will need all the same partners that are in this response to help us pull that off.
Thank you, Jackie. Next question. Can anyone give us any updates about Cripple Creek? And what I'd like to do before we try or attempt to answer that is let you know that we were going to have Richard Mann from the city of Victor here today to discuss that from that side of the county. But unfortunately, he had a family emergency he had to respond to, and our thoughts and prayers are with him. It's non-COVID related, but all the same, it is a family emergency. So Mark or Darren, could you talk a little bit about everything that we're doing for all the cities within the county and kind of give an update if you have one on the city of Cripple Creek?
In terms of, if you could just kind of,
maybe.
I can talk a little bit to the schools, what they're
Great.
doing there. And, they're doing a lot of the same things we are. It's virtual learning, but, and they're in the 4-day week. But they're doing a great job feeding everybody as well. And so make sure you take advantage of that. They're getting that out there. Their graduation, they have 16 seniors this year. So it's a little bit different situation than when you have 190 seniors. And so what they're doing is their track isn't a great track to start with. They're going to actually do it on the track, driving around the track in cars or golf course or something. So it ought to be a hoot to see. But they're working hard and trying to make sure their kids are engaged there up at Cripple Creek and doing a nice job from that direction as far as schools go.
I can touch on the economic impact and recovery. We do have representatives from the city of Cripple Creek and the city of Victor on that team, so they've been engaged. When you look at what's happening on the ground in Cripple Creek and Victor with respect to additional resources for families, as Ms. Mavi mentioned earlier, a lot going on at the Aspen Mine Center, food distribution, and financial assistance through that center as well.
and I can touch on a couple things that Victor and Cripple Creek. If I remember correctly, they've waived some gaming fees to assist locally as well. Victor has waived their fees for their utilities and are looking to actually waive an additional month on that right now for all local residents. I don't know, Commissioner Detmeier, there was a $300,000 fee that they waived for the gaming industry, correct?
Yes, that was the device fee for the month of April. That was they waived that, and that was to the tune of over $300,000. So big impact to the city of Cripple Creek's budget for sure.
And I can add a few more things regarding Cripple Creek. I would tell you about Aspen Mine Center. Ted Borden's the head of our food division for the whole county, but he is working that out of there. They're also, Salvation Army is, if you look on their website, and I believe it's on our Teller COVID website, that you can call for eviction assistance. That's a resource for them. And also they have the Pikes Peak Workforce Center unemployment work that they're doing at the Aspen Mine Center. And I believe Community Partnership is supporting that process with a staff member coming down to help, because it's a little challenging, I believe, with the unemployment, filing for unemployment and working that system.
And if I can, I guess I'll just rehash some of the things I said that the city of Woodland Park is doing, but some of the things that have occurred as a result of the COVID-19 stay-at-home order. The city's municipal court has suspended operations until June, right? At this point, we'll pick up again. So anybody that has a municipal ticket, that won't happen until the following month. Again, we're going back to, in terms of utilities, and we've waived all penalties for both utilities and sales tax remittance. So there's no penalties there. That's a pretty significant reduction in cost to both businesses and local residents. Deferred our utilities on a case-by-case basis by as much as 2 months, with the potential to waive it again or defer it again for another month. So we're looking at all that, and all at the same time, we're continuing to provide essential service, public safety, and law enforcement to the community under these circumstances, even with those deferments of revenue.
Thank you, Darren. Mark?
Yeah, Sheriff, I'll expand on that as far as county relief measures are concerned. Treasurer Salusta, he's going to be waiving late fees for property taxes if those taxes are paid by September 1st, but you need to contact his office, and he's directly engaged on a case-by-case basis with those requests. And the Assessor Simmons, out of his office, he's extended the business personal property declaration filing deadline to June 15th. And those are the two things that we've been doing from the county side.
Thank you, Mark. Of the current local active cases, how many are now self-quarantined and how many are hospitalized? Jackie?
So to protect the privacy of those individuals in smaller areas like Teller County, we are not releasing any kind of demographic or identifying information unless there's a direct need to protect the health of others in regards to COVID-19. As the situation is ever changing, if a need arises to release additional information, Public Health will provide those details as necessary.
How can I volunteer to help? Kim, you want to take that one?
Sure. We kind of have a volunteer clearinghouse through community partnership, and it's on the website. What we're doing is asking. They'll ask when you call to volunteer. They'll ask you questions, your background. We're specifically looking for medical emergency type response too, but also whatever you're interested in. And as each agency needs volunteers, we will send each agency a group. But we do have a person from Community Partnership who does outreach and keeps all the volunteers engaged. And if you look at the website, I can give it out. It's 686-0705 is the contact, but it's also on the website.
Thank you, Kim. Mark, this question is for you. What can we do to support our local businesses in our community to make sure they are still here after this event is over?
Well, as I mentioned earlier, there are a lot of resources available at the state and federal level for business relief. Again, there's the Paycheck Protection Program, if we can get that thing funded at the federal level again, the EIDL loans, the Economic Injury Disaster loans. We have that great resource, as mentioned previously, the Pikes Peak Small Business Development Center. Mark Coulier is the executive director down there in El Paso County, in Colorado Springs with that office. They have a lot of experience with injury, recovery, disaster type work with floods and fires in the past. They have free consultants that'll work with businesses directly. So please contact AICTA down there at the SBDC, Pikes Peak Workforce Center. Again, Tracy Marquez, the executive director, and her staff do an amazing job connecting with businesses. There's actually a business representative that's specifically dedicated for Teller County businesses right now. Please reach out to the Pikes Peak Workforce Center. There are also some state sites that you might want to visit that really can be helpful for businesses. We've got the Colorado Department of Labor and Employment, CDLE site, the OEdit site, Office of Economic and Development and International Trade. Check those two sites out. When we look at it from the specific locality level, I think the most important thing that we can do right now, again, is prepare for recovery and make some good, smart decisions to get businesses back open.
Thank you, Mark. Next question. And we have a clarification for the phase one. So what it is are we in phase one for opening businesses in Teller County, as in Trump's 3 phases of opening America? Mark, do you want to take a shot at that?
Thank you, Sheriff. I think, again, a lot of this in terms of the reopening phase, whatever phase we're in right now, is going to come down to the governor. And we'll know at the end of this month what the governor is going to do, if he is going to look at these phases and mandate those across the counties within the state. Or are we as a county going to be responsible for making the decisions in what our phasing tiered approach looks like? I'll reiterate, we're going to be prepared either way if the governor makes the call or if we do, and we'll be smart about it. And we just need to make sure we're protecting vulnerable populations, of course, and do the right thing. And it's going to come down to a lot of folks from OEM, from public health, and other guidance from the state and the feds, and implement whatever's best for our individual county.
Thank you, Mark. Next question. Why are we approving burn permits? Don, you want to take a shot at that?
When the timing is right and the weather conditions prevail, we do have burn permits that are out there. We also have to remember, as I've said many times, fire season is coming up. Mitigation is key and critical to prevent large-scale wildfires. So as permits are issued, they are not allowed until they've cleared them through the sheriff's office, which takes the phone call from the permit with the permit number, etc. Right now, today, we're still declining active burning based upon true conditions throughout the county. And again, we have to remember, one yard may have a foot of snow, the next yard may have none. So we work in that manner to make educated decisions. So thank you.
Thank you, Don. And just a little bit more. In this county, we will always accept burn permits and we will approve burn permits. But like Don says, just because you have a burn permit does not allow you to burn unless the conditions are right. How do we determine those conditions? A lot of time that's a discussion between the fire chiefs, the OEM, and myself as to whether the burn rates for trees and different things are at a level that they can burn. So that's how those burn permits, or why burn permits are approved, but that doesn't mean that you're approved to burn. Next question for Kim. Are child and adult abuse cases still being dealt with during this time, and are workers available?
Yes, they are. We have seen our numbers drop immensely, and for example, child welfare or child protection has gone down 70%, which is very concerning to us because we know it just doesn't stop. And with all the stressors that we're experiencing is concerning. Our protection cases are getting reported. But again, if you want to call it in, it's 1-844-CO for kids. Again, 1-844-CO for kids. And we do have, our workers are going out in the field. We often call them the forgotten first responders because they do have to respond to abuse and neglect. They're going out doing home visits, going to hospitals, going everywhere else that you need to do to meet the needs. So we are working, we're fully staffed, and we're responsive.
I'd like to say real quickly too, part of our PPE supplies are to make sure that these responders, who are first responders, also have the needed supplies to be able to do their job. So as we take a look at our supplies of personal protective equipment, we are trying to look across the board to every type of responder to make sure that they are safe and the people they are responding to are safe. So it is a very concerted effort amongst all of us to understand that it's not just EMS, it's not just fire, it's not just law, but when we have fantastic service organizations such as ESF 6, we need to make sure that they are protected as well. Thank you, Kim, for your efforts.
Thank you, Kim and Dawn. This question is for Jackie. El Paso County uses a tracking system to make certain information available to the public regarding how many cases they have in each local jurisdiction. Can we get that generalized information out to the public?
So again, I will say that to protect the privacy of individuals in a smaller community like Teller County, we have approximately 24,000 population. They have 750,000 population. So it's a lot easier to identify with very little information here in Teller County, which is why we are working to protect the privacy.
Dr. DeWald, do you have something to add?
Yeah, so also remember that really these numbers are not that important for our community to understand, hey, this one particular spot, Victor has this many people, or Cripple Creek has this many. Remember, we know there's community spread of COVID, so those are the people who met testing criteria, got tested, whether it's they were hospitalized or whatever it was. But remember, you should assume that there's still COVID in your community, whether or not there's a number to put in that particular area of the county. That's why we have social distancing. That's why we have all of these recommendations, and why we're requesting everybody comply by them, is because you don't know if your neighbor has COVID or not. And remember, a lot of people, and the reason COVID spread so quickly is because there's a lot of asymptomatic people who transmit it. So if you're going to the grocery store, wear a mask. And don't go to the grocery store every day. Stay home and do it once a week or once every 2 weeks, whatever you can, and try to bundle when you're going and picking things up. That's the reason. So the numbers, I know a lot of people want to know numbers. I understand that. It's that need for knowledge and have a good feel, but don't get comforted by the numbers. Also, don't get freaked out by the numbers, because they don't tell us the whole story.
And just to confirm, is when we talk about universal precautions and we're talking about just act as if anyone you come in contact with could have it, some of the new research on COVID, on the virus, has shown that it is contagious for 48 hours prior to any presentation of symptoms. And so we kind of go back to that. Even if you think somebody has symptoms, and that, we do want you to cover your cough and wear a face mask when in public, but we still have that period where you don't know. And so we ask for that universal precaution.
Thank you. Next question. There's a lot of talk about the cities waiving water fees. What about the neighborhood providers in places like Spring Valley and Highland Lakes? I can take that one. Those water providers are private organizations that dispense water. The best way that you can get that answer would be to contact them direct and request that information from them. Next question. For Darren, when will the swimming pool open?
I think this is a condition-based as well in terms of the public health order. It was closed as a result of the public health order, so it would be contingent on rescinding that order and or the decision we're talking about now about how do we phase our community back to, get back to business. So at this point, it's indefinite, but we're planning on the reopening now.
Wonderful. How can those of us stuck at home help? What can we do to help those that are essential and working in our communities? Anyone like to take that question? Kim?
Yeah. You can do a lot of things. For my agency and the whole community, when you see someone in need, call someone. Our communities are more isolated than they used to be. And so I've noticed myself noticing different people in my neighborhood. Are they okay? Are they homeless? What's going on? And just report if you have a concern, or just say hi, or social distance. But just be aware that, there's lots of different things. And if you have any concerns, please reach out to whatever agency you feel is appropriate.
Thank you, Kim, and I'll add a little bit to it. There's a lot of projects that we have that we could use help from people, and that's making the masks. Renee can post some things on there if we need anything from the community onto the Teller COVID website. The other thing that we reached out to the faith-based communities and to our subdivisions is to check on people that are in your subdivisions. Just like Kim is saying, if there's somebody in your neighborhood that is elderly and they need help maybe getting groceries, help those folks. I think the biggest thing that we can do to help our communities is just be kind think of others, and really, those are the things that make our community stand out, and that's probably the best thing you can do to help us. So thank you so much for that.
Sheriff, can I add?
Well, of course.
One of the things that we did, and we took this initiative from Cripple Creek, was we started with the homeowners associations handing out pieces of red and green paper. You can put it in one of your front windows inside your home as people walk up and down the neighborhood. If you see a green, things are good. If you see a red, ask if you can help. That's something that, without personal contact, play ring and run, open the door, ask what help they need, and see if you can help your own neighbor. And we have reached out, I think, passed out 3,000 or 4,000 of those sheets. Just something so simple as a red and green sheet of paper. That comes from Cripple Creek. What a fantastic idea as people walk the streets. So thank you.
And we've had hundreds of volunteers come out and engage in the COVID-19 response and relief effort here in Teller County. It doesn't surprise us because we have amazing folks here in Teller County, and also like to thank all the veterans that have come out to volunteer during this time.
And I think there was a component in there, Jason, regarding supporting essential people in our community. And, you know, there are tremendous numbers of essential people, from our Public Works Department to our Office of Emergency Management to all the people up here. And this is just a really small group of people with a tremendous force behind us that is supporting this community. I mean, we're talking thousands and thousands of people from all different aspects of the communities, and not only just Teller County, but the surrounding areas, the region, the state. It's unbelievable. The networks extend out into meetings with national leadership, with national experts and international experts as well. And I think, you know, sticking a sign in your window saying, "We support our first responders," or "Thank you," or doing those kind of things can go a long way as well. And even your trash people picking up garbage, doing things like that, put some signs of encouragement out. That means a lot to the people who day in and day out are out there. I just think about a lot of our providers, and they're working so hard that they don't have time to run to the store and get their groceries or do things. So please reach out to them and say, "Hey, can I help? I'm going to be running to the store tomorrow. What do you need? I'll drop it off on your front stairs."
Thank you, Jeremy. Steve, do you expect the online learning to continue into the summer, or will it finish when the school year would have normally finished?
You know, and I'll take it a step further. Will we be online for the rest of the year? The rest of this school year, we will be. We're going to be offering that. If we were to open our doors tomorrow, which we're not, there'd be a half of you stay home anyway. And so the online learning will continue the rest of this school year. That being said, we'll probably do a formal announcement on Thursday, and it'll probably look a whole lot like I think Manitou and Cheyenne Mountain. We're probably all going to be together in this, but I want to make sure we visit with our board on Wednesday as well. But we'll run it through the end of this school year. If our high school students are still working and have an opportunity, you know, we have a little different opportunity for them to finish some work. They'll get an opportunity to do that. We plan on having summer school, and summer school will be virtual as well. And we're going to do that. Now, if we're fortunate enough to where we hit May and we're able to open it up some, it's not like we can just flip a switch and bring everybody back, because we have to really think about what do we do when we come back. Make sure that all our technology we bring back in is clean and ready to go, that we have people maybe who have visited hotspots during this time. You know, what do we do with those folks that come in, whether it be our faculty members or our students? And so we want to leave the door open so that we can maybe do activities where we bring kids back in before the end of the school year. That door is open depending on where we are as we attack this thing. Do I think that'll happen? No. I think we'll probably be at home the rest of the school year. But but I still want to hang on to the hope that maybe we can get back, and so that's where we will be. I anticipate a big celebration when we can all come back together, and I anticipate a lot of parents celebrating sending them back too. So we're looking forward to that. We'd be glad to have them when the time comes. And I want to add something real quick. We talk about people that have helped us, and you've heard mentioned a few times today, community partnership. They have been huge. They took over the distribution of food and feeding people before we could really hit that after spring break. And they're taking, you hear so many services that they're offering. And they have just been a jewel for us. And we really appreciate that, being a part of that. Our faith-based communities has done a tremendous service to our community as well, and as a part of almost every organization here as far as helping out. So as schools are no different. They've helped us. We appreciate it, and we just keep lifting each other up. And one more thing I'd like to hit, we asked about kids that are abuse cases, those type of things. We are mandatory reporters. Our students aren't with us. We don't see that, and that's one of the numbers are down. So we're counting on you to look out for the kids next door, that make sure everybody is taken care of. You've suddenly become the eyes and ears. We see them every day when they're at school, but it's kind of hard to tell when you're looking on a computer screen how things are going in the home. And so our counselors are reaching out. We do one-on-one with all our kids. We try to do check-ins, but we need your help as well with that to make sure that everybody's safe.
Thank you, Steve. Next question. Do we have to wear a mask when we're out shopping? What about the employees? Do they have to wear a mask?
So the wearing a face covering in public is a recommendation in Colorado. And again, if you think about how this virus is transmitted or spread from person to person, it's that cough, sneeze, respiratory wetness that comes out. So the recommendation is for anybody out in public. However, when you look at a retail store or something and you notice that the employees maybe are not masked or are wearing their mask incorrectly, some of that is an education, and we have done some outreach to employers and their staff to help them understand that if you're going to wear it, you really do want to wear it properly. But you also have to look at, with the limitations and the lack of supplies for PPE, where would the employers get those supplies to provide to their staff? And that has been one of the sort of problems, as far as that they don't have the PPE or the masks either. And so that is probably one of the reasons why it came down as a recommendation, not a requirement. I do want to emphasize, though, that face coverings are recommended. The cloth ones are recommended. However, there are CDC guidelines that accompany them as far as making sure you're wearing them properly. I mean, it doesn't do much good if it's not covering your nose and your mouth, as well as the cloth does need to be laundered regularly, and making sure you're taking it off, because if you don't do that properly, it's not necessarily going to prevent the spread of transmission. And those guidelines are available on the Teller County COVID website.
And an important part to remember with that is wearing a mask is not a substitution for social distancing. And one of the fears that we have, and we do see it, is when someone puts a mask on, they get a little more comfortable, and then they tend to slowly start moving closer and closer to people, especially if both people have masks on. So remember social distancing and mind that, Colorado's used the one ski's length apart. The other one I saw from another area was 2 Golden Labs length apart. So whichever works for you, keep that in mind, because we're not very good at judging 6 feet distance, quite frankly. So if you are wearing a mask, we do recommend it. If you're not, either way, keep your social distance.
And wash your hands.
Yes.
Thank you both so much. So a question about where can we get the red or green paper for the windows. So what I think I'll do is I will have Renee post the size of the paper. That'll be up to you to do the red or green. I think we started with about 10,000 of them and we gave them out. So we're out of red and green paper for now. So we'll work on that through the website. So just go to tellercovid.com and we will list on there the size and shape of the paper to be placed in the window next to the door. Next question. Steve, how do I get my kids into summer school?
We'll be putting out a lot of information on that. Our parents have been great in picking up on things that we're sending home. The newsletters are coming out. Our principals have done a beautiful job putting together newsletters and getting those out. And we'll start doing some video things as well as we get closer. But right now, we actually have, we're starting to do kindergarten and preschool roundup. And it's really hard to do without physically doing that. So you'll see information out there that we kick out on our Facebook page, on our website, and we'll also be sending things home so that you can have information on how to sign up for that. I know virtual summer school is going to be tough, and it'll look different. All depend where you are. High school will look different than middle school, which will look different than elementary. But we'll be sending that out to parents so that they know that there's opportunities. And it isn't just an opportunity to be able to catch up if you're behind in sometimes it's just to keep engaged or maybe even to get ahead. And so we'll be getting all that information out through the normal channels that you're getting now, through your newsletters and through our social media and websites. So good question.
Thank you, Steve. And what we'll do is we'll post a link to that on the Teller COVID website once Steve gives it to us. Darren, may we post signs in our yard thanking first responders, or will we get in trouble for yard sign violations?
I will just say, I won't try to speak for our planning department. I would encourage you just to abide by the municipal code on signage.
Next question. Can we make cookies for first responders? Can we take them to the station? Here's what I would tell you. Normally, we would take cookies any day of the week. The issue is that not everybody is reporting to the stations anymore. Because of the highly infectious part to COVID, we are strategically placing people throughout the county and the city so that they're not always together. So we don't want them coming to one location or one point to get anything. And that's just something we've implemented so that we aren't getting people sick. And quite honestly, in this county, we've had very few sicknesses for our first responders. And that's been a silent win for all of us, that we aren't having a lot of the issues that a lot of counties and cities are facing. A lot of that is because we started doing this about a month prior to even the first orders coming out, and we took it very seriously as to what was beginning to happen. So for us, that's a silent win, but thank you so much for offering the cookies. I normally love cookies, but for right now, I think we're going to ask you not to bring those in until this is over.
But bring us a bunch when it's done, please.
Where can people get masks? So I know that this was a discussion that we had yesterday on the homemade mask, because a lot of people, like me, can't make anything correctly when it comes to sewing or other artistic designs. So what we'll do is we will post on the Teller COVID website locations. We have talked to our faith-based community for making those and being able to give out disbursement points. So we will work on getting that to the website for people, for those of you that want them. You know, I have to say, and Jackie reminds me often, that the CDC guidelines, that these masks are not medical masks. They're personal protection for you only. So just remember that as you go forward, they're not as good as the surgical masks that are out there. But they're better than nothing. Jackie, are you still offering immunizations currently? And if not, when will that become available again?
Oh, I want to do it tomorrow if we could. About 4 weeks ago, as the response to COVID was sort of starting to consume our staff time, we went down to what we call essential services. And so, and I hate to say, but immunizations is not included. It's more in regards to our family planning program and pretty much with those. We have canceled our clinics, all clinics, except by appointment only for those essential clients or the essential services that clients may need through the end of April. It is likely it'll go at least through mid-May, and again, we're reevaluating it about every 2 weeks. I can almost promise you that we'll be open for the back-to-school immunization rush, Steve. But I'm just going to say, check our website, give our office a call. It's kind of, as this situation evolves rapidly, we are there for you. We're going to try to be there for you. But unfortunately, immunizations are not considered like essential. They can wait. So.
Well, what I'd like to do is take a few moments for each of the panel members to give some closing thoughts to how things are going, thoughts on what we may see, and just what they generally believe during the COVID-19 as a response and how we're doing with it. Don, would you like to start that out?
Thank you. I'd like to take a moment to let everybody out there know one of the things that the Teller Combined Agency team has done is continue to manage this incident in accordance with NIMS and other federal guidelines when it comes to emergency management. With that, what's important to understand is there are 15 emergency support functions, ESF 8s. We have involved all 15 into our daily planning cycle, our weekly planning cycles, and our projections as we go forward. Every one of those groups has hundreds of people underneath them. I would venture to say that, truthfully, there's probably 600 to 700 people on a daily basis that conduct everything from food services, public education, our recovery branch. As we are going forward, it's not just medical, law, fire, and EMS, but it's public works, it's communications, it's road and bridge, it's firefighting, it's all 15 emergency support functions working together. We put together a daily plan, and we work to that plan amongst us. And this is how you manage an incident. So as we go forward, please understand, it's not just one small group that does this. It's a combined effort all the way from the boots on the ground to the very top. I have probably the easiest job, along with Jason and Jackie. We just manage. It's the boots on the ground that do the work. When we talk about 400 lunches, well, take a look at Friday. That's 1,200. Yes, so as we go forward, the community partnership, they are unbelievable in the work they've done. They've merged into us, and we only help coordinate their efforts. But it's all the volunteers in Teller County. It's all the agencies working together, and that's what makes us a better community than others. Thank you.
Thank you, Don. Kim, would you like to speak?
Sure. Along with what Don was saying, Teller County Human Services, really, we ebb and flow, and we're kind of the recovery part, and this has been a different response. And so we're learning, but we're functioning on all levels. I encourage anyone to apply online or on our paper applications. Again, the stimulus dollars does not affect any of the benefits. So whatever that is, that's not included when we determine eligibility. Also, remember that we have many programs. If you have questions, follow the numbers, and please report abuse and neglect of children and adults, because it doesn't stop, it continues. Along with that, we really have, a part of our emergency response, have brought all the nonprofits and all the different volunteers together to really serve the whole community, and who is the experts. And I can't say enough about all the nonprofits: Aspen Mind Center, Community Partnership, Storehouse Ministries, the Taylor Senior Coalition, Woodland Park Senior Organization, and Little Chapel. They all have come together, and we have really built on the strengths and improved our delivery, and we're still learning. Just to let you know, we're getting a huge supply of baby supplies, and that's been kind of our, I hate to say a joke, but we're the depot of all baby supplies. So, and we're working on how to get those out and how to manage all that. So I have to say thank you to all the nonprofits, because DHS cannot do anything, and I would never want to do everything, because they are a huge resource, and this will go on for a while, but we are here to support, so please utilize the services. Thanks.
Thank you, Kim. Dr. DeWall?
So I'd first like to say, of course, thank you to our first responders, especially our 258 emergency medical services responders in our region that are available 24/7 and have put in a tremendous amount of effort in this event, along with everybody that Don and everybody else has talked about. It's really a team effort, and I do want to reassure our county and our communities that we are well ahead of the game. We work very closely with CDPHE, Public Health and Environment, and other folks, and even throughout our region. And Teller County is doing an amazing job from day one. Before COVID was truly known to be in our community, we already had a team together, and we were looking weeks and months ahead. And as Don's mentioned with OEM and our incident command structure, we're really spending the time to plan ahead. We have a lot of things coming out in the future from the emergency services side to even protect our community more. So you will continue to hear more and more changes in response in a good way to help our community. And I want to once again encourage you, if you think you have a medical emergency, if you're having symptoms of stroke, some major traumatic event, don't be afraid to utilize the emergency services system. Our community has done a great job limiting the times that emergency services and hospitals have been used in a good way. So we're in a good spot to treat not only COVID patients, but other emergency patients. But don't be afraid. We will keep you safe. We will keep you as COVID-free as possible in the community and be there for you. And thank you for the community for being partners in this as well.
Thank you so much, Dr. DeWall. Commissioner Mark Dittenreiter.
Thank you, Mr. Sheriff. Just a couple more comments before I wrap it up. I got a text from Clerk and Recorder Crystal Brown on county relief measures. She wanted me to let y'all know she is also waiving late fees, and she's open for appointments to assist the public. One more comment about unemployment. I know a lot of you are struggling out there, laid off and so forth. National unemployment numbers came out the other day, 22 million across the nation. Those figures rival the Great Depression. Last 4 weeks in the state of Colorado, 231,000 people have filed for unemployment. Go to the Colorado Department of Labor Employment site to file for unemployment if that's something you need to do. Also, the Pikes Peak Workforce Center, they have an ongoing virtual job fair with 50 participating businesses. And again, some of those resources for workers go to the Teller COVID site, and the Willett Park Chambers site also has a job center tab there. There are jobs available. Go to connectingcolorado.com. If you look at the Pikes Peak region, right now there are over 800 jobs available. And to close, I know a lot of people are laid off. I know a lot of businesses locally right here in Teller County have been struggling, and we feel for you. We're getting closer, though, to beginning the phasing out of this stay-at-home order world that we've all been living in for the past few weeks. So that's positive. The collaboration, as Dr. DeWall and Don Angel indicated, is really impressive. The cities, the county, our regional partners, hospitals, the nonprofits really have rallied during COVID-19. Thanks again to the volunteers, and rest assured our incident command team, Unified Command with OEM and Don and the Sheriff and Jackie, Public Health. Thanks for all the work and the whole team. It's been quite impressive. Thanks.
Thank you, Mark. Jackie, would you like to say a few words?
Yeah, and I guess you can look at anything as having pros and cons to it. And, the con side of this situation is sort of, the people who are getting sick and infected and the consequences of the COVID virus itself. But on the other hand, the pro is an opportunity for our county to learn and see what we are capable of. Emergency preparedness and response is one of public health's essential services, and we saw this coming. It was predictable. Even when it was over in China in late 19, we were monitoring it, and when it came, across the ocean, came into the United States, we knew it was inevitable. It would be coming into Colorado and then Teller County, and so we do have plans. We do have pandemic plans that we and again, COVID, we dealt with H1N1 a little over 10 years ago. So the plans are universal. It doesn't matter what the name of the pathogen is. We know what we need to do. And so my hope is that you understand that the county has come together, that we are collaborating, and even though that this event and response is public health and content, that public health is too small to deal with, protecting the health of the county, and that, as everybody has said, we have all come together and collaborated and coordinated with this. And I don't know, I feel proud to be in Teller County, and I feel safe. So hopefully you guys do too.
Thank you, Jackie. Steve, you want to give a few quick words?
You bet. In life, we never want to waste a good crisis. And it's an opportunity for us to learn, and we're learning a lot to be able to learn how to deliver education virtually, and for learning to keep going. Please understand, your students, teachers, they want to be with your kids. They're dying out there to be able to not be able to be with your kids. And a lot of times the kids are the same. To be able to see the kindergartners that I saw when we first came back, let's see their teacher through the computer and start crying because they missed their teacher. And a lot of times that teacher, that is the person that sees them, that hears them, that loves them, and they aren't getting that at home. So make sure we're lifting each other up. This is an opportunity to be able to take love to a whole new level. And so that's kind of exciting to be able to do. So let's take this crisis, learn from it, and we're learning too, because we're not doing everything perfect, even though we were way ahead of most school districts because of some of the things that we've been able to do electronically. We're still learning every day. So let's lift each other up and keep learning, and we'll be fine.
Thank you, Steve. Darren, would you like to say a few words?
Sure. I want to just emphasize some of the same comments that I've heard from Jackie and Steve, and that I'm encouraged by the learning that this county is achieving in this environment. It's going to make us stronger for any future emergency events that faces us. I'm really encouraged by how collaborative and how closely the county and all of our cities are working together to address this issue. I've heard your voice, Sheriff. I've heard the county administrator's voice and face virtually, Commissioner Dettenreiter, everybody's face more times in the last 6 weeks on this issue than I have in the first 18 months that I've been the city manager of Woodland Park. So I'm incredibly encouraged by how much more collaborative we are and how closely we're all working together to address this issue. And I think that's encouraging for the future as well. I want to say that I'm just as thankful for our first responders within the city of Woodland Park and throughout the county. Our city is still open for business in terms of we're still providing permits for construction, essential construction permits throughout the city, so that stuff can get those business activities still can be conducted. We're still out fixing potholes, clearing snow off your streets, so our ambulances and our first responders can get to your homes. We just need, I just want to thank everybody that's working together to really achieve more not only as a city but as a county as a whole. So thank you.
Sheriff,
Thank you, Darren.
I got one go back. Sorry. I think it's important that we also recognize the fact that we have 2 Colorado National Guard members who are experts in planning and recovery that we have been able to tap into, and would like to again thank them for their service to not only our nation, but our county. Thank you.
Thank you, Don. So in closing, I just want to say a few words. You know, all the men and women here on this panel and everyone in our community is part of this event. We live it, we breathe it every day. You turn on the radio, the TV, it's there in front of you. And there's a lot of information being put out there. And the one thing I'll say is that, you know, under fire conditions, under law enforcement conditions, under tidal waves, we always have a rule book we can go back to and look at and go, hey, this has been done before. This is how it's handled. It's been done 10 years, 5 years, and each one of us have probably responded to some of those events. The problem with COVID was we are now writing the rule book on how people after us are going to go forward with how this type of pandemic will be dealt with. So we're in the learning stages as well too. And I think that's been the hardest part of a response to something that is evil, that sits in a room with you and you never see. And that's what causes fear. And I think for us in government and in public safety and just all aspects of what we do, that's why it's so important for us to be open and transparent to our communities and really have them be a part of the response. And I don't think we could ask for a better community to really be a part of that. Because right now, our community is engaged. They're helping us become engaged. And every day, I see more and more evidence of that. And I just want to say thank you to our community. And in closing, I do want to say thank you to one of our partners today, and that is the Charis Bible College and the Andrew Womack Ministries for all of the help in providing us the platform to be able to do a live stream. It's so important for us to get that message out. I'd like to say thank you to Tommy, one of our producers, for the podcast that he does. Anything that you missed today, you're going to be able to see on the tellercovid.com. It's live streamed there today, but you'll also be able to see the reruns if you want them, or be able to catch it later. So just thank you for all that you do to support us. I really appreciate it, and thank all the panel members for being here today. And in closing, you can find us on tellercovid.com, Facebook, Twitter, Nextdoor, all those different processes. So thank you, Teller County. Thank you for being part of Coping with COVID-19 broadcast. And we'll see you soon. And be kind to one another, and thank you.